All right. Are we unmuted?
Yes, let me, I believe so. This is Tracy Plouck at the Ohio Department of Mental Health and Addiction Services. We'll get started in just a few seconds. Okay, we have affirmation that the sound is working okay, so I will go ahead and get started. Thank you for joining us. So far we have 170 people with us on the webinar. I wanted to spend a little bit of time today talking about the department's specific initiatives that you will see in the governor's executive budget. He did his rollout press conference yesterday afternoon, and you can see on the screen here the 4 significant pillars of focus. There's more information related to these and other strategies online, so make sure you take a look for that information. However, I wanted to spend time today talking briefly about some of the highlights related to mental health and addiction services. This is a quote from the governor just a few weeks back at the signing of Senate Bill 319. He remains very focused on what more we can do, what more progress we can make as it relates to the needs of individuals who are living with a mental illness and or an addiction. So in terms of some general priorities, we are pleased to say that we are going to be continuing our operations at all 6 of our state psychiatric hospitals. We have been treated very fairly in this budget by the administration. We are able to maintain the past investments that we've articulated as priorities, including strategies that are related to the opiate epidemic, but of course not just limited to that. I'm also going to talk a little bit more about prevention and other strategies that we can bring to bear in order to further support progress in local communities. Our funding recommendations are shown on this slide here, and as you can see, we are held very stable relative to our current state fiscal year 2017 levels in the aggregate. The red slide is representing GRF on this stacked bar chart, and the blue component is all funds. And so you can see that we are pretty stable. With that said, though, I want to note that in our GRF appropriation in 18, there is a very, very slight dip that is then backfilled with non-GRF sources for fiscal 18 only. And then in fiscal 19, we return to GRF levels that are more consistent with fiscal 17. So in the aggregate, we are unchanged. We actually have a very, very moderate increase. But I wanted to call your attention to the fact that we are drawing on some one-time resources in 18. We had some balances and some different funds that we wanted to spend down in order to be as judicious as possible as a state with the General Revenue Fund. And so as we talk through this series of slides in this presentation, I'll be calling your attention to some areas where we take an all-funds approach in this budget instead of just taking a GRF-only look. And for those of you who watched the press conference yesterday online or in person, the governor actually talked about approximately 15 agencies are using more of an all-funds approach instead of just some traditional reliance on general revenue funds. So just be attentive to that detail as we walk forward through these slides. Generally speaking, we went back and looked at our expenditure trends across all of our existing investment areas. And to the extent that we determined that the amount that we had appropriated for our services or supports in fiscal years 2016-2017 had more than we could use, we brought that down into alignment with what we thought we would actually use for this next biennium. And so I wanted to call your attention to our partnership with the Department of Rehabilitation and Corrections and just talk about that, because that's really the most significant place where some changes came to bear. As you may recall, in the last biennial budget, we had a significant investment that occurred wherein the Department of Mental Health and Addiction Services partnered with DRC to basically assume responsibility for the provision of recovery supports in all of Ohio state-run prisons, and then increase by about 50%, or approximately 60 staff, the number of clinical professionals who are actually providing addiction treatment within the prisons. That has occurred, and we are supporting that investment as we move into this next biennium at those same staffing levels. On the community transition program side, which was services and supports that would be available to individuals after they undertook training in the prison, were released in the community, and reestablished themselves in recovery in the community, we had more appropriation than we used in this biennium. And so the amount that we requested from the budget office within the 18-19 executive budget represents a funding level that supports existing trends of the number of individuals who have treatment in the prisons and then come out into the community and are moving into the community-based programming. So I don't really see this as a cut, because it reflects how we are actually using the dollars, but rather it's better aligning our appropriation with the amount that we believe that we will need as we move into the next biennium. So that then enabled us in the overall budget to make some additional augmentation in some of our other program areas that I will discuss here in just a little bit. And then finally, in examining where we are in this biennium and how that applies to the next biennium, we also took a look at our federal appropriations, and to the extent that we had more spending authority or more appropriation in certain federal areas than we believe that we would use, we also brought that appropriation request in alignment with what we actually think that we will need. So, if you see a reduction in non-GRF appropriations, it does not represent a cut, but rather an alignment with what cash we have at our disposal and what we actually think that we would use in terms of leveraging that appropriation. So then, with all of that said, we took this all-funds approach where traditionally, in cases where it may have been a GRF-only investment, we may be bringing to bear resources from some non-GRF accounts to help basically round out the commitment that we are making in different areas, and I'll talk through that. So first area that I wanted to highlight briefly is state psychiatric hospitals. We are maintaining our existing capacity at all 6 of our sites. We have just under 1,100 beds statewide, and we are very full, and we want to make sure that we're able to support that capacity going forward. So I'm very pleased to say they will be able to do so. We also spectrum of providers, including other non-state hospitals in the community. And I want to just give a very brief recognition to Ohio Medicaid here for continuing to work with us on the ability of Medicaid managed care plans to be able to pay freestanding IMDs or freestanding psychiatric hospitals for services to their members, their managed care enrollees, because that hopefully will help to increase overall access on more of a geographic basis, as hopefully some of these hospitals will begin to connect and become part of the managed care plan networks. So look for more information on that as we go forward. A few of the lines that I know are traditionally of particular interest to the stakeholders, I just wanted to note here that we are continuing full commitment at fiscal year 17 levels in both fiscal year 18 and the 421 line, which is our traditional subsidy to the ATOM boards, is unchanged at $72 million, less one legislative earmark, the only legislative earmark that had appeared in that line item in this biennium for Chardon schools. That has been removed. And so the reduction of about $360,000, I believe, that shows a decrease in that line is reflective of that earmark specifically. The residential state supplement program continues at $15 million a year. We have done a lot of work on that program in the last few years, and are pleased to say that we've been enrolling folks at a good clip, and people are able to connect with housing that is helpful to them in their recovery as they're living, oftentimes, although not always, with serious and persistent mental illness. So continuing at existing levels, and then also recovery housing. We have at $2.5 million. This is one of the areas where we brought to bear some non-GRF funds in fiscal year 18 in order to make our commitments intact relative to fiscal year 17. So $2.5 million for recovery housing in each year of the biennium. A little bit about prevention. We have a GRF line item that is specifically for prevention of wellness. That's the 406 line item. You can see there in the red, we have just shy of $3.4 million appropriated. This is full support, less one legislative earmark, the one that was included in this biennium, for about $120,000 for NeoMed. So with the notwithstanding that one particular earmark, we are at continued levels for the prevention line item for GRF. And within that, you can see the list of how we plan to invest those resources. $500,000 will be designated to improve access to evidence-based practices in school settings. $1.5 million will be focused on dollars that will go through the ADAM boards in order to purchase prevention services in the community, and that could be in a community setting or in a school setting by certified prevention specialists that are employed, by providers within that community. And suicide prevention efforts at $500,000, and then our traditional allocation to the ADAM boards. This pass-through amount is unchanged relative to our current biennial amount. Moving on to specialized dockets, this is another area where we have maintained consistency in the amount, in the aggregate, but we are taking an all-funds approach. And so there are some amounts from different sources that are brought to bear to assure continuity here. But our addiction treatment program, which has, I believe, 15 counties articulated in this biennium's temp law, and we expanded to another set of counties earlier this fiscal year. We will continue to be able to fund all of the participating counties, which number 22 counties, into the next biennium, and we will have a potential for some expansion to additional counties. However, we're going to need to see how the end of fiscal 17 washes out before we can make some estimates as to exactly how many counties we would be able to incorporate in a further expansion. And then for those of you who follow this area in some detail, you may know that we have two other sources of funding that have supported different components of Ohio's overall specialty docket network over a period of time. Back from when ODATIS was a freestanding cabinet agency, there are some dollars that went to some specific courts, all of which are certified specialized dockets at this point. And those dollars could be used somewhat flexibly by those court programs. And then we also had an administrative investment that was added, I think, about 3 years ago at the level of $5 million to be covered to cover court staffing. What we are planning to do is take these two sources and make more consistent their use. We're proposing to liberalize the court's ability to use the administrative dollars that currently are limited to just over $50,000 per court for staffing, and enable them to use that for staffing, for drug testing of their enrollees, for recovery supports, or other needs as they deem appropriate. I think this is in response to some feedback that we've received from a number of judges and court administrators on how they would like to see these dollars be available. And so in taking both of these two sets of resources, making more consistent the approach, I think we'll just have a more efficient administration of the overall resources that we have in this area. And again, that is separate from the ATP resources, but I wanted to mention them both here because they're both sources that assist with specialized dockets in Ohio. A couple of points of some additional investment within the appropriation that is included for our department in the executive budget. We have been able to identify an additional commitment of $1 million per year for our Strong Family Safe Communities program. This is something that was established back in 2014. We're currently in our 4th year, and it provides grants to different communities to be administered by ADAM Board, Family and Children First, DD Board, some collaboration of those entities to fill some specific gaps, whether it's related to respite or mobile crisis or different engagement strategies, really pretty flexible resources to address gaps. So that has been a well-regarded program with some positive outcomes, and so we have an opportunity here to make some additional investment and wanted to do so. Similarly, we have the Community Innovations Criminal Justice Program, whereby we make investments through the ADAM boards to benefit jails, in some cases community-based corrections facilities, with diversion programs, treatment in the institution, because we know that Medicaid does not reimburse in that setting, or potentially some linkage to services upon release. Again, these are programs that are identified by the local team, and we fund what the local team feels is the gap that they would like to address. So we currently have $3 million per year in community innovations. We are proposing to move this up to $4 million a year. Again, this is taking some sources from some different line items and fund sources in order to get to the $4 million, but we have accounting of how that will occur. And then we have some workforce initiatives, and I think there's a slide in a little while talking about the workforce initiative. So we have obviously the continuum of care requirements that will go into effect this summer with respect to the ADAM boards, and we also have Medicaid redesign on the horizon. And so both of those, I think, create some additional interest in assisting to recruit and retain staff at levels that are perhaps higher than what exists today. And so we want to be assistive in that regard, and we've got some resources set aside in order to be of support there. And then finally, naloxone for first responders. You may recall that we have a $500,000 per year earmark in the current biennial budget that we're operating now. This year, given demand for these resources, we have actually redirected an additional $250,000 to support this program above and beyond the amount that was earmarked. We are proposing to spend the $750,000 in fiscal year 18 and fiscal year 19 as well, which is consistent with where we believe we will land our 2017 investment in this area. And these dollars are through the local health departments, county health departments, for the purpose of first responders. We have language that went into 319 that was just passed earlier this month and signed by the governor that allows these resources to be used for Project Dawn sites locally in the event that first responders do not or cannot use the resources for some reason. So we want to make sure they're put to use. Workforce development, I mentioned this just a moment ago. We have an all funds approach here, and a couple of things I want to call your attention to. Within our community innovations line item, we have $2 million that is directed toward some workforce support and augmentation, and then we have $1.45 million in our resident trainee program. And basically, what we want to do here is adopt some different strategies, including things like some targeted tuition loan repayment program opportunities to help assist providers in underserved areas to recruit and retain staff that can be an asset to that community going forward. Our community innovations line item, and we've got a few different programs that are funded out of here. I was sure that we would get questions on how we tally to that entire appropriation amount. So this just provides you with an accounting of what we have programmed into that line item. Total appropriation is $9.25 million per year. Of that, $4 million is for Strong Family Safe Communities, which is the entire amount that is dedicated for that purpose. $2.5 million for the criminal justice innovations, which is the jails, grant money, and about $1 million from our criminal justice line item. And then the $750 from the loss I just discussed, as well as the workforce development that I discussed a few slides ago. As far as language changes, our department is not making any changes of, huge scale. Within this budget, I would characterize as somewhat minor changes to assist with program efficiency, those sorts of things, but nothing that I felt was needed to call to attention of folks today on this webinar. The bill should be available for review in the next week or so, so we will certainly be able to respond to questions as you have them at that point. But because the bill is not yet finalized, I can't really say with 100% certainty what the exact large-scale change via the language. So for more information about the budget, we have a budget page on our website that is listed here. And then to the extent that you have any questions or comments, we also have an email box that has been established to receive those questions and compile responses. So with that, I think that ends the presentation for the webinar. We have some questions that have come in, so I can try to respond to those here. The question is, will the PowerPoint presentation be shared with webinar attendees? The answer is yes. We're actually recording this webinar, and we will make both the presentation and the recorded webinar available on that budget page. Any other questions? Next question, let me take a moment to read it. The question is regarding the Strong Family Safe Communities and the community innovations investments. Is that to continue existing recipients or to add new? I have not discussed this in great deal with program staff, but I think that there's general consensus here that we would like to offer these grants on a biennial basis. And so the grant that we would make at the beginning of this biennial would be for a 2-year period. And I think what I would like to do is rebid the entire amount. So if you're an existing recipient, you can apply to continue what you're doing, to make modifications to what you're doing. But I think this gives us an opportunity to have some discussion if there are grantees, and we know that there are, who are underspending their current year amount, to understand if that amount is really necessary going forward, or if there might be, some sizing that could come into effect so that we can then incorporate others. But regardless, there is $1 million more per year for both of these initiatives, and so I do imagine that we will be able to expand the number of recipients to whom we are able to make grants for this period. Next question. It's a long question, so bear with me for a moment. Scroll up. It's a very long question. There's no way we can make that bigger. Okay, I'm going to try to read this. In the parity section of OHT's white paper on improved care coordination, it cites ensuring coverage features like co-pays, deductibles, and visit limits are not more restrictive for mental health and substance use disorder benefits than they are for medical and surgical benefits. Does that mean the new 1115 waiver using co-pays will exclude SUD, SPMI expansion enrollees? In the parity section of OH, it's reading it again. I will need to confer with OHT and provide an answer back on that, and we can do that via the website. I just want to make sure that I'm getting the entire response correct. And we have the white paper pulled up here, but we can. And then for the next question, for suicide prevention, is it funded at $500,000 each fiscal year? The answer to that is yes. And we had $1 million appropriated for suicide prevention each year of this current biennium. And in looking at planning forward, some of the investments that we made this time around were one-time investments. And so we feel that a $500,000 appropriation to support this very important initiative would be sufficient in each year of the next biennium. So, you know, I don't want to have appropriation assigned to areas where we don't think that we will spend it, because I don't think that's in the best use of the taxpayer dollars. So it is $500,000 a year, and we do intend to build on the investments that we've made in this biennium. Okay, it looks like that was the last question, and again, I will follow up on the question related to the OHT white paper, just because it's kind of difficult to read this online, so I just want to make sure that I'm being appropriately responsive. So thank you for tuning in, and we will have this posted hopefully later today, possibly tomorrow morning, for folks to review. We've got a new one. Oh, there's a new question. Do you intend to use the recovery housing funds in the same way as previous years? We are actually looking at whether, I think the answer is possibly. To the extent that there continue to be gaps in local continuum of care as it relates to recovery housing, and resources may be an obstacle in some of those places, we absolutely want to make sure that there are resources available in order to help meet that need. But with that said, if we are to the point where there is not additional need in some areas for recovery housing, we are actually looking at some different options on how we could be supportive to recovery housing overall, and use the resources in a different way. So we've had some discussions, just initial discussions with the Ohio Council, Ohio Recovery Housing. So we will be back in touch on that, but we're very pleased that we have a $2.5 million commitment for recovery housing each year. All right, I think we're ready to sign off. This has been exactly a half an hour, so I appreciate your attention, and we look forward to working with you through the legislative process.